Hey folks, thanks for listening to the Doc Buddy Journal. I'm your host, Eric. Unfortunately, during the recording of this episode, we had a technical snag that did not allow us to capture video either from myself or from our special guest, Dr. Joy Himmel. Don't let that take away your enjoyment of the show. It's still a fantastic episode with Dr. Himmel. And with that, we'll take it away. Thanks. Hello and welcome back. I'm Eric Sunset, your host of the Doc Buddy Journal. Here at Doc Buddy, we deliver healthcare solutions that take the pain and cost out of broken workflows like OpNote, which gives ASCs the power of instantly generated operative reports. You can learn more about OpNote at docbuddy.com. And today we're joined by a special guest, Dr. Joy Himmel. Dr. Himmel is the Director of Counseling Services at Old Dominion University. She also has over 30 years of experience in providing healthcare services in a variety of practice settings. Dr. Himmel has been a surveyor for AAAHC since 2009 and was recently elected to be chair-elect of the AAAHC Board of Directors. She also serves as part of the teaching faculty with AAAHC. Dr. Himmel, thanks so much for joining us.
Oh, you're welcome. It's great to be here.
It is our pleasure to have you on the show. And I know before we hit record, we're kind of joking around. Can't believe that ASCA is about 2 weeks away. You're speaking at the ASCA annual conference in Orlando in just a couple of weeks, promoting mental health and wellness for your staff in your ASC, which is a talk you're doing Friday morning. What can you tell us about your speaking engagement without giving too much away for anybody that would be attending in person?
Sure. Yes, I hope everyone attends. I think it's going to be a great session. It's going to be a combination of just kind of learning what the data is showing out there related to workplace wellness, and then give a lot of ideas related to how ASCs can help in terms of really paying attention and focusing on staff wellness in the workplace, what they can do related to not only their practices, but protocols, policies that would really enable staff to just feel like they matter and feel like they are valued within the organization. We're also going to be talking about personally, what can you do in terms of taking control of your own health and your own mental health, what you can do to help reduce stress in your life. Everybody has stress. It's a matter of how you handle it and what you do to monitor it and manage it. And so we'll be doing a lot of work there related to what are some ideas that might help you as an individual deal with stress in the workplace, but also stress in general. And then just really describing the importance of self-care overall and giving some suggestions for, how do you take care of yourself? What does that look like? What are some ideas? What are some tips that tend to just help with centering and allowing your body, your mind to relax, and doing that in a way that really tries to just manage the daily stressors. I think that everybody experiences from time to time. So I think it's going to be a good session. We're going to end it with a mindful meditation. That's going to be about a 10-minute exercise just to give everybody a little bit of a taste of what visual imagery and mindful meditation is all about and the benefits of that. And then we'll have hopefully some time at the end for questions and just some dialoguing. So I think it'll be a good session. Definitely a departure from the other sessions, I think, at ASCA, but certainly one that I think is extremely important.
Yeah, that doesn't sound just like a good session. That sounds like a great session. And not to take us too far off track, but some of the recent clinical perspectives that have been on the show revolve around just that, what you just described around accountability to yourself. That if you, as the patient, are in search of a particular outcome, there's certainly a lot that your physician, that your providers, that your clinical care team will do to help you achieve that. But ultimately, the responsibility falls to you. So I think that sounds great. And to end with a mindfulness meditation, that's something that I've dabbled in. That'll be a treat for those that haven't yet had the opportunity to try that.
Absolutely. And I've done this in some other settings, and what I find is healthcare providers are great at taking care of others and being very other oriented. But when it comes to, really prioritizing their own healthcare, their own time that they are allotting for relaxation, pleasure, etc., they don't take time for that. And so, really being mindful of the fact that you do have to take time for yourself. You do need to feed your own soul before you can give to others. So, again, just giving, I think, the participants some experience with that and, giving them a taste of, what it's like to be able to really just kind of quiet the mind, quiet the body, and feel the benefits of that.
Yeah. Oh, yeah. And yeah, again, not to drag us too far off topic, but both the physiologic benefits as well as the mental health benefits are astounding when you make that a part of your day.
Absolutely.
So, Dr. Himmel, I'm not quite sure how recently you were elected to be chair-elect of AAAHC, but I want to wish you at least hopefully not too belated of a congratulations on that, because that is
Thank
very
you.
cool.
Yeah, thank you very much. This year, I'm serving as chair-elect. In November, I will take over the chair position and have that for a year. It's a great opportunity. I'm only the sixth female in AAAHC history to be chair of the board, and I'm the only individual with a behavioral health background. So there's some real opportunities here and nuances that I think are unique. I think AAAHC as an organization has really expanded their horizon and scope in terms of really developing the product in a way that I think is holistic. Certainly, behavioral health is one of the categories that's consistent with our accreditation standards. And organizations that have behavioral health, certainly that applies when they are looking for accreditation. But really having the chair of the board of directors as a behavioral health provider, I think just gives a lot of opportunity to the organization to look at things in different ways and really expand on some of the areas related to not just physical health, but mental health as well.
Yeah, and that's one of the things that I was able to see in one of your recent press releases, that there's and this is in air quotes, a new emphasis on mental health and well-being. And I think that's true in both senses of the words, that it's both new, but it's also been there all along. Because if you have people going crazy doing their job, that's that doesn't let them do their job for very much longer. So, can you speak a little bit to what that means? How are you going to be emphasizing more on mental health and well being?
Yeah, so one of the things that for those of the audience that are accredited with AAAHC will notice in version 43, which is our updated accreditation standards, is that in the category of administration, now there is a standard related to workplace wellness and really expecting organizations to have some attention given to workplace wellness in general. And, as surveyors, we'll be looking at organizations in terms of what's in place. How are you assessing workplace wellness? With that assessment data, what are you doing about the data that you gather? Are you taking a pulse of what's happening in the workplace related to your employees? Is there satisfaction? One of the things that we know is that based on some recent research, there's a lot of employees in the healthcare field that are just not satisfied with their workplace environment and they don't feel supported. And one recent study related to the Clinician of the Future global report that was reported in Forbes indicated that 47%, so almost 50% of the U.S. healthcare workers are planning to leave their place of employment within the next couple years. And so, people are restless. And I think now more than ever, Organizations need to, ASCs need to pay attention to workplace wellness. What's going on in the workplace? How are they assessing that? How are they meeting the needs of their employees? So vitally important, I think, not just related to accreditation and complying with accreditation standards, but just being able to recruit and retain employees.
Yeah, some of those stats are shocking, and moving one job to the other, that's a very different conversation than a lot of the sentiment of burnout causing physicians and other providers to retire ahead of schedule, if you will, earlier than expected. And there's obviously a crunch of physicians that we're starting to experience now. But you kind of took the words out of my mouth, Dr. Himmel, that I would imagine for the center who makes it a part of their culture that employee mental health and well-being is important. And I don't think we're talking about that. Everybody needs to have a smile on their face. This needs to feel like Disney World, and you need to feel like it's Disney. You're visiting Disney World on the inside every day, every minute of the day. Because that's the other end. I would
Right.
expect as a non-expert. That's the other end of the spectrum. That's equally as unhealthy as being burned out or being run down. But if
Right.
you, as the ASC, can implement a culture of, hey, there's good days, there's going to be bad days, but we're all here together, and here are the strategies that you individually can do, and then here are our center's policies. This is a really long walk for a short drink of water, Dr. Himmel. But having said all that, I would imagine if you have that front of mind at a center, that does enhance your ability to retain staff and eventually, and to extend that to being able to hire staff as well. Is that right?
Well, exactly. And I think, healthcare providers, just like any worker, wants to feel like they matter. They want to feel like they're respected. They want to feel that their managers encourage self care, and that things like taking time off are respected. Again, much of the survey data that I've looked at, employees aren't feeling those things, and if leadership is not taking that into account, if they're not looking at that, then they really, I think, are at risk at losing workers and having that high turnover rate. We know that chronic workplace stress does lead to burnout. And what occurs with burnout is lower productivity, lower motivation, more irritability and complaints are surfaced. People tend to call out sick a whole lot more. And the picture doesn't look very bright. And so you really do need to, I think, look at what kind of stressors can be managed within the workplace. I think many times we work in environments that, just because of the nature of it, and ASCs are a good example of that, there is some high stress. There are high expectations, and there is a high workload. The problem, I think, is when employees do not feel connected and supported. That's when that workload becomes less tolerable. And so, even in our high kind of stress environments that we have to work in related to healthcare, if there's a sense of support, camaraderie, if there's a mutual respect and a feeling that employees have some say in decision making, it goes a long way to reducing that perceived stress level. And it makes it more tolerable. So, these are just some of the things that I think are extremely important in terms of really preventing that thing that we call burnout.
Sure. And it sounds to me, and again, as a layperson, to make the stresses of the job more tolerable, not to wave a magic wand and eliminate them, though I know we all would if we could, but that's not how reality, is woven together.
Right.
What are some of the major keys that you would share with the ASC world that you can't wave that magic wand, but to make stress more tolerable on your staff or on yourself? Here's what I recommend.
Yeah, I think creating a atmosphere where, you know, employees, clinicians, providers um, have a path related to communicating, giving feedback, and getting support. So, if that's making wellness, mental health much more of a priority, more of a focus, a part of staff meetings, a part of clinical meetings, just really being open to, decreasing the stigma around it. So many times what I hear is healthcare providers recognize that they're having some mental health symptomatology, but it's either stigma, or they feel like they don't have the time, or they often feel like, well, it's not that bad. So, really encouraging providers, employees to take the steps necessary to take care of their own health, encourage that, support that, um, and reducing stigma by talking about it, is again, I think, so important. I think other things that can be done is doing trainings with your supervisors, with your leadership, so that what is being provided is a much more supportive type of supervision. So many times people are thrown into leadership positions, be it nursing management or management within the ASC, but they haven't been provided any kind of training on how to really lead in a compassionate way, or how to provide supervision in a way that is supportive. So, providing that kind of training to supervisors, to leadership, I think, just goes a long way. Um, and then, talking about resources. So many organizations have EAP programs, employee assistance programs, that are historically very underutilized. So, if you do have a program like that, really talking about it a lot. I think many times when the surveys are done and the questions are asked, did you know that there's an EAP? Have you used it? Many times the answer is no. I didn't know it was there, or no, I didn't use it because I didn't know if it was confidential, or there's other things. But, typically they are completely confidential. Typically, participants can have anywhere from 3 to 4 free sessions, and then they're referred, if need be, to a provider that takes their insurance. So there's that bridging. But really utilizing the resources that are available, not just with EAPs, but having a running list of mental health resources in the community is extremely helpful. Just so employees, clinicians know that this is supported, and this is something that is fostered within the organization. Again, reducing that stigma of mental health.
When you look, Dr. Himmel, at the balance that an ASC has to strike, where they are scratching and clawing out of the same barrel of employees that the hospital, that's maybe in the same parking lot, a stone's throw from their center, are looking to hire and um, increase their headcount with. If you're at the surgery center, are all of the strategies and the cultures that you just described, getting those into place, being sure your employees are aware of them, does that sort of help you combat, do you think? And maybe that's not the right word, but remain a competitive employer compared to the hospital, which as a rule will just be able to pay more for the same or similar type role. So I guess a better way to ask that is, if you have that really strong culture at your center via the strategies that you described, does that make hiring and retaining staff easier as compared to a hospital where maybe you're a little bit more of a cog in a machine?
Yeah, I definitely think so. And I think as ASCs really build upon this, it's a marketing approach, because you can much more easily recruit clinicians, employees, if the work environment is conducive to providing support. If supervision is provided in a kind and compassionate manner, if they feel respected, if they feel like they matter, if there's connectedness between coworkers, and that's one of the most important things. people stay at jobs because they like who they're working with, and so really fostering those relationships, building those relationships, maybe doing things after work together as a team, really kind of fostering that team building is so important, because people will stay at a job, even if it's stressful. They'll stay at a job if they feel like they are valued, if they feel like they're respected, and if they feel that they really connect with the people that they're working with. So, fostering that environment, I think, of care, the culture of care and connection is definitely the key. And that will, I think, put an organization above another, because based on the data that's being collected, especially in the last few years, that's what the workforce wants. They want that connection, they want to feel valued, and that's the most important thing, I think, when you're really looking at a position, you're looking at a workplace. Is that in place?
Yeah, and as you say, the workforce itself is really ready to have that. Mental health, excuse me, is a priority now, like it's never been in the past. So as individuals, obviously, I'm very interested in my own mental health. As businesses, though, there's maybe if you're not looking at it the right way, and not doing it to take better care of your employees because you care about them as people, but you're just looking at line item management, right? Which I know was not the folks that are listening to this show. They're not the folks that are going to be listening to you at ASCA or that are at the event. But there's sort of a cynical side to this where, if I just have happier employees, I have to hire less of them less often, right?
Hmm.
So this is a really ugly setup, Dr. Himmel, that mental health being more a priority now than ever. Is it because everybody is just ready to not work themselves to the bone and grind themselves down to a nub? Or is it just that it's better business practice if we have better employees, and that's the only reason we're interested in it at this time?
Yeah, I think there's multi levels here. So definitely, I think if you have a happy worker, you're going to have a more productive worker. Your organization is going to work better together, and you're going to get better outcomes and results. So, I think that's a given. I think we, have a work environment now that there's an expectation, I think, with employees that um, work life balance is going to be taken into consideration. And we went through that period of COVID. I had to bring up COVID, but COVID, where there was a lot of changes in the workforce, a lot of changes within organizations. A lot of organizations had to figure out how to do things differently. I think one of the things that came out of that was an expectation overall, and this is a broad generalization, but an expectation that a workplace needs to be more cognizant of things like work life balance, mental health, wellness, stress reduction, than maybe previously. And I think that's a move in the right direction. I think that's certainly important. So, I really think that probably that's maybe one of the benefits of one of the outcomes from the whole pandemic, is that, we have different expectations of what's important and what matters. And um, maybe a little bit more picky. Employees have been related to, what are they going to be doing, for 8 hours a day or 10 hours a day? And is it going to fit into their life plan? And are they going to be able to maintain work life balance the way they need to?
I couldn't agree more. And one point I'm very curious in your perspective on is that change in workforce sentiment around expectations. Like you said, what are they going to be doing 8, 10 hours a day? To build on what we've said before, who are they going to be doing it with? And do they like these people, or can they at least tolerate them? Is this a shift in mentality based on an age bracket? Are older workers or younger workers feeling more or less this way? Or do you see it just across the board and it's the same rate of sentiment change for all ages?
Yeah, I think it's across the board, but I do see it, I think, in the younger generation a bit more. But I really do think it's across the board. I think that, that period there in 2020, 2021 really allowed people to be very self reflective in terms of what they want for themselves. And I think they were able to, again, kind of just take stock of, where they are in their life, where they are in their life plan related to vocation, but in a general sense as well, and what they need to do either the same or differently going forward. And I think a lot of individuals figured out that they need to be more assertive in terms of just what they want for themselves related to not just work and vocation, but in a general sense as well, family and other things. And so I think for a lot of individuals, they were able to put some things into perspective, and kind of resurfaced from that time frame, with some new insights related to themselves, what they want for themselves, others, and the world around them.
What if you can go back in time, obviously pre COVID, and I guess that would have been March 2020. I think that was sort of when we started to shut things down here in the U.S. But if you go back prior to that March 2020 timeframe, and obviously the canary in the coal mine wasn't in great shape going from January to March 2020. But sort of the status quo prior to COVID, at least to me, it didn't seem that employers were all that interested in feeling about or hearing about how their employees felt about the workplace. Obviously, compassion is on a scale, or willingness to listen is on a scale. But that's a pretty marked change, is it not?
Yeah, I'd say it is a change. And again, I see this as a change for the better. And a great opportunity, I think, for organizations to look at what are the strengths, what are the areas for improvement, what are the gaps, and what are the opportunities for change. And so it is a change, and again, I think that time frame, um, everything kind of came to a halt, and I think as people were putting on the brakes, organizations were putting on the brakes, it just gave that pause to really look at things with maybe some new eyes. And I'm just so pleased that mental health wellness has moved up in terms of priority, where I think it should have always been. So, if the pandemic did us any favors, to me, that's one, that it really kind of pushed the envelope a little bit in terms of what's important. And what is important is our wellness. What is important is our mental health. Um, Certainly physical health as well. But, if you don't have these things in place, and if you aren't prioritizing and focusing on these things, everything else kind of crumbles. And I think there was, an astute evaluation of that through that period, which now I think is trying to take its fair course, which I think again is a real benefit for our society and for organizations, and for all of us.
You got to take every advantage you can get to get better, for lack of a better term, even if that opportunity is spit out from the backside of a pandemic.
Exactly.
So you referenced change there a couple of times, and you're absolutely right. COVID did provide a lot of opportunities for change. One thing that's changing really quickly in healthcare, though, is its willingness to at least evaluate, and healthcare as a whole, its willingness to at least evaluate artificial intelligence solutions, or so called artificial intelligence solutions. What are you seeing in your world, Dr. Himmel, with regard to AI and healthcare?
Yeah, I think the possibilities are just astounding related to AI. And I think we've barely scratched the surface of how we're going to be using AI in the future. But, AI driven tools related to not only diagnosis, but analysis of data, I think is so useful in the healthcare arena. Really looking at AI to help us with looking at patterns. As in our human capacity, we pale in comparison to what AI can do related to the vast amount of data that it can look at, analyze, look at patterns, look at precursors, look at risk factors, which is going to be so important and is important related to surgical centers looking at risk, looking at post op risk, pre op risk, mining that data in a way that only AI can do, and then consolidating that data into something that is usable in terms of just looking at outcomes. I think it has immeasurable opportunities related to quality improvement metrics. I know it's being used a lot right now in diagnostic specialties. Really looking at areas related to how can it be helpful in the area of pathology, radiology, and so what's exciting to me about it is that it's a new frontier, and I think we're going to be using it in so many different ways that we don't even realize at this moment, because as I said, I think we've just really scratched the surface related to its usefulness.
I would tend to agree with you. We're obviously very early stage in what AI can do. There's a lot of really great potential use cases, which you did a good job of laying out, a really good job of laying out. There's also some sort of pie in the sky. Maybe yes, maybe someday, maybe in 100 years, you could look at something like an LLM replacing a physician. I don't think that that will happen anytime soon. I certainly won't be alive to see it. But it is really neat to see healthcare run towards AI with open arms, where generally it's, a little reticent to look at new technology, or sometimes even any technology.
Exactly. Yeah. And, anything can be used or misused. And certainly there's some risk related to AI that can be misused. But, I think I'm seeing, a whole lot more use related to chatbots and, use on websites and, just the collation of information that is being collected, analyzed, and then summarized. It's just really an amazing resource.
Yeah, not this is a little bit out of my realm of expertise. I certainly talk about it a whole lot. Would love your thoughts on this though. The data shows, and essentially every reputable survey you can see, whether it's from class research or anything that Medscape has published, but that like the number one driver of physician burnout, just physician burnout, not necessarily anybody in healthcare is burnout, but it's around technology, being forced to use bad technology, which is a paraphrasing of how the surveys are structured, but that's essentially what it boils down to. I think what you just hit on, though, that around chatbots, being able to respond to maybe routine patient portal messages, and that's not to say click a button, click send, and then forget it ever happened. There obviously needs to be some level of review. But if you can take away that administrative burden that physicians across the country and even into Britain and Canada, we've talked to them on this show as well, that is what drives them absolutely crazy. So anything that can be done to reduce their administrative load seems like a good thing to me, whether it's a chatbot, whether it's chat GPT or anything in between. Are you seeing any early results around that function, Dr. Himmel?
Yeah, I am. And again, we, we're so in the early phases of this. Um, I have I have clinicians who are using an AI platform to generate documentation, and so it's a huge time saver for AI to be used within a clinical setting. compose a clinical note. And, the clinician reviews it, sure, but the time saving is really essential. Chatbots are being used also to provide information. Again, there's a lot of capability here related to just reducing the time element that we have to uh, really spend on things that could be more automated. And certainly AI is one of those areas where we can look at automation and look at it in a way that really is very customizable, involving AI and chatbots to really decrease the time it takes for us to do our jobs, because things like documentation, certainly is time consuming. And if we can have some assistance with that and have AI generate much of that documentation, it's clearly a time saver and efficient.
And look at you at the very early end of the bell curve for adoption there, Dr. Himmel. That's great. Glad to hear you got a little lightning in a bottle.
Absolutely. Yeah, it's really been fun to work with.
And speaking of that lightning in a bottle, if there was one thing that you could say from the mountaintops that every ASC across the land would hear and would know that you said it, what do you think you'd tell them?
Well, I think I would say, in the light of wellness and in the light of our discussion today, I think the important thing is, now more than ever, is the time to take a look at the work environment, do some assessment of the work environment, either formalized or just anecdotally getting people together, and then determining what you can do to make your workplace either less stressful, more cohesive, more supportive. Um, Now is the time to take a look at that, because we are, I think, in a era here of really needing to compete with other organizations related to our workforce, and really trying to make sure that our workforce is retained, because it's so expensive and time consuming to keep hiring new people all the time. So we do want to retain our workforce. We want to value our workforce, and really just taking a moment, taking a pause to take a look, take a pulse of things, figure out what you need to put in place, getting everybody on board with that, being very collaborative in that process, and making a difference.
That's really well said. Well, in between now and your speaking engagement at ASCA in Orlando, which will be in mid-April, promoting mental health and wellness for your staff and your ASC, where will people be able to connect with you?
Yeah, they can find me on LinkedIn, and certainly connect with me on that platform. So that would probably be the best way to connect with me.
That sounds great. And we'll be happy to get a link to your profile in the show notes, along with every other link that we discussed, including being able to register with ASCA for the annual conference. There is still time. And Dr. Himmel, thank you so much for your time to join us. This has been a great chat.
Thank you very much. I was very pleased to be here, and it was great talking to you. And hopefully, the audience will um, be appreciative of some of the things that we talked about. And if you're at ASCA, please come to the session.
Absolutely. And on behalf of the entire Doc Buddy team, I want to thank you for listening. Be sure you're subscribed on Apple Podcasts, Spotify, and YouTube so you can always hear or watch the newest episodes of the Doc Buddy Journal. Until next time, I'm your host, Eric. We will talk to you soon.